So, your second to last one now. Biological therapies for abnormality. And first off, we have drugs, and in particular, chemotherapy.
That's what we call the drug treatments. It's chemotherapy.
Yep, and these can be split down into 3 different types. Antipsychotics, antidepressants, and anxiolytics. What are antipsychotics?
Basically, these work by blocking dopamine receptors in the postsynaptic neuron,
That's what it's called.
Reduces dopamine and reduces hallucinations and delusions in psychosis, I think. Yes.
Yep. That's right. However, it is only effective, this is a bit of evaluation, it's only effective in 50 to 60% of patients.
And there are severe side effects.
Like uncontrollable movement of your feet, your hands, and your face.
Yeah.
Antidepressants.
MAOIs.
These are a type of antidepressant.
Yep. Prevent breakdown of serotonin and noradrenaline. Higher serotonin, lower adrenaline. Leads to a happier person.
Yep. However, it only worked for 60 to 70% of patients. Actually, that could be quite a good positive, because 60 to 70% is quite a lot.
Yeah, it is. So
but apparently it's a negative.
It doesn't work for 100%.
Exactly. And
30% of people respond to a placebo antidepressant.
Yeah, so they basically think they're getting an antidepressant and they respond to that, so it could be all in your head.
Yep, there are side effects such as drowsiness.
And it is addictive physically and psychologically.
Yes.
Which are all negatives. Anxiolytics.
Benzodiazepines, which we talked about in biological, boost GABA. What does GABA stand for?
I don't know, but that doesn't matter because you just have to say GABA. But basically, a recap of GABA, it's where you slow the nerve cells' activities, which decreases serotonin, because if you have high serotonin, you're going to be anxious. So the fact that it decreases serotonin means it relaxes your body.
So that's what anxiolytics do?
Yep, in particular benzodiazepines.
Yes. So let's evaluate that.
Alright, on the negative side, you can become dependent on these.
Courses?
So, yep.
Oh, you can.
Yeah, so the courses are restricted.
And it treats the symptoms but not the cause of the anxiety.
Which is not good.
No. Let's look at ECT now.
Electroconvulsive Therapy.
This is passing a small electric current through the brain to cause an epileptic seizure. A strong muscle relaxant and anaesthetic are given to the patient. Electrodes are attached to the head and the current is passed through for a second. It induces a seizure for 2 minutes, and when after 15 minutes the patient regains consciousness, has no memory of the events, and this has to be done 2 to 3 times a week for a week to a month.
Yeah, and these courses can be repeated if necessary. Oh, and a little bit else. Also, physicians noted that very few epileptics with schizophrenia. Basically, how it came about is that physicians noted that very few epileptics had schizophrenia, so they linked mental disease with the incompatibility of convulsions, or other word is seizures. So, some evaluation. Obviously, it's a very controversial treatment, and people aren't actually sure quite how it works, so that's not very good. It's not quite the safest.
However, it is successful where all other methods have failed.
It is. Also, it's a quick form of treatment compared to the drugs and therapies, you only have to go in for 15 minutes.
And this is a positive, which is weird, but 60 to 70% of patients improve.
They do. However, a large proportion of these can become depressed again in the following years if they don't keep taking it.
Yes. There's also negative side effects such as memory loss of events before the treatment.
Yeah, and obviously a decline in the use of it recently, especially in the UK. Not necessarily in the US, actually, it's increasing in popularity, but in the UK, for now at least, it's decline in use because it's obviously a frightening concept, and also it can be abused, which is not good. And also effective drugs are providing attractive alternatives.
Okay, great.
And that concludes your biological therapies for abnormality.
We'll see you in psychological therapies.